This model provides a description of the appropriate personal protective equipment that is to be worn when interfacing with patients that have been identified as suspected or confirmed cases of COVID-19. At the end of this model, you should be able to describe the appropriate PPE for COVID-19, describe the appropriate technique for donning and doffing PPE, and describe the concept of risk assessment for PPE. The use of personal protective equipment, or PPE, is recommended in the care and management of suspected or confirmed cases of COVID-19. Healthcare workers who work with COVID-19 patients must be proficient in donning and doffing PPE. It is important to note that the use of PPE is not a substitute for proper infection, prevention, and control practice. There are rules that govern the use of PPE. Note that PPE can serve as a transmitter of microbes when contaminated. As a result, all PPE have a limited life and must be discarded after use as indicated, usually after each patient's use. The use of PPE is not a substitute for poor infection control practice or nursing procedure. For example, wearing gloves does not mean that you do not practice hand hygiene. Finally, PPE should not be used to allay personal prejudice or fear without indication for a procedure, as this can sometimes increase the risk of infection. Risk assessment is critical for all activities at the health facility. It is important to assess each healthcare activity to determine the appropriate PPE that will be needed for adequate protection. Point of care risk assessment is the responsibility of all healthcare workers and should be done before every patient encounter. Point of care risk assessment also enables the healthcare worker to identify the additional steps needed to be taken to protect themselves, the patients they care for, and others in the environment, such as other staff, visitors, family, and caregivers. The choice and combination of PPE ensemble to be worn when dealing with COVID-19 patients should be based on a careful risk assessment that considers the risk of exposure and extent of contact dissipated with blood, body fluids, respiratory droplets, or open skin. There are important questions to ask and think about before carrying out care on any patient. You need to think about the amount and level of contact you will have with the patient. What is the likely infection? And what is the mode of transmission? Think about the procedure that is to be performed. Are there any risk of splashes, sprays, needle stick injury, or inhalation of aerosols? And what are the available means to prevent or minimize risk? Now, let us see what the appropriate and complete PPE for COVID-19 are. They include a face mask, which is used to protect the nose and mouth, or the N95 respirator, which is used to protect the respiratory tract from infectious agents, the face shield, which is used to protect the face, or goggles to protect the eyes, hand gloves, which is used to protect hands, and gown, used to protect skin or clothing. Who should put on PPE? Patients with suspected or confirmed COVID-19 infection should wear a face mask when being evaluated medically. Healthcare workers, doctors, nurses, and health workers who work in COVID-19 treatment centers must be proficient in donning and doffing PPE, and this requires specific training. All support staff who clean the isolation room, handle contaminated supplies and equipment, launder reusable supplies, and collect and dispose of infectious waste from COVID-19 patients should wear gown, gloves, and face masks while working in the treatment center. All laboratory staff who handle patient specimens and body fluids from suspected COVID-19 cases should have complete PPEs on while performing their official duties. All laboratory support staff who clean and disinfect laboratory equipment used to test COVID-19 specimens should also have complete PPEs on while performing their official duties. Safe burial teams who remove bodies of deceased COVID-19 patients and prepare them for burial should also wear the appropriate PPE as specified in the NCDC guidelines for the safe management of a dead body. The type of PPE needed for COVID-19 will be determined by the type of clinical interaction with the patient and the degree of blood and body fluid contact anticipated. All clinical interactions as shown in the table require health workers to perform good hand hygiene. During triage, medical masks should be worn. For the collection of specimens for laboratory diagnosis, gown, respirator, goggles or face shield, and gloves are to be worn. When attending to suspected or confirmed cases of COVID-19 who require healthcare facility admission and no aerosol generating procedure is to be performed, gown, medical mask, goggles or face shield, and gloves are to be worn. When attending to suspected or confirmed cases of COVID-19 who require healthcare facility admission and an aerosol generating procedure is to be performed, gown, respirator, goggles or face shield, and gloves are to be worn. A PPE cart should be used to store or organize the various PPE. There are several types of PPE carts. It could be a trolley, drawer, or cabinet. It is important that all healthcare workers know where to locate each PPE. A description of how to properly don the various PPE will be provided next. Before donning the PPE, ensure that all the required PPE are laid out. Always make sure that the right size of PPE is provided. Plan for a suitable location to don and doff. Plan for waste disposal after doffing of PPE. And always perform hand hygiene before donning of PPE. These steps are to be followed when donning the PPE. Step 1. Perform hand hygiene to ensure hands are clean. Step 2. Don gown. Step 3. Don mask or respirator. Step 4. Don goggles or face shield. And step 5. Don hand gloves. Detailed process to take when performing these steps will be described next. Please refer to the module on the standard precautions of 5 moments for hand hygiene for detailed steps to take to properly perform hand hygiene. The first PPE to wear is the gown. Before donning a gown, always ensure to perform hand hygiene. Put arms in gown sleeves and pull the gown towards the shoulders to fully cover the torso from neck to knees, arms to wrists, and wrap around the back. Fasten at the back of the neck and waist. And tie the gown securely but in a manner that it can be easily untied when you begin the doffing process. Leave some length of the tie so that it can be pulled and untied without much effort. Before donning mask, always ensure to perform hand hygiene. Remove the mask from the box and make sure there are no obvious tears or holes in either side of the mask. Identify the top of the mask, which is the side of the mask that has a stiff bendable edge meant to mold to the shape of your nose. Then, identify the colored side of the mask. This is the front of the mask and it should face away from you, while the white side touches the face. There are different types of masks with their specific methods of donning. To don a face mask with ear loops, hold the mask by the ear loops and place a loop around each ear. To don a face mask with ties, bring the mask to your nose level and place the ties over the crown of your head and at the back of your neck. Then secure with a bow. For a face mask with bands, hold the mask in your hand with the nose piece or top of the mask at fingertips, allowing the headbands to hang freely below your hands. Pull the top strap over your head so that it rests over the crown of your head, and then pull the bottom strap over your head so that it rests at the nape of your neck. For all mask types, once the mask has been worn, fit the flexible band to the nose bridge and snug to face and under chin to ensure the mask is fitted to face and secured. To properly don the N95 respirator, follow these steps. Remember to perform hand hygiene. Hold the respirator in the palm of your hand with the straps facing the floor. Take the upper strap and place it at the middle of your head. Next, place the N95 respirator on your face, covering your nose and mouth. Then, pull the bottom strap over the top of your head and place it at the middle of your neck. Mold the nose piece of the respirator over the bridge of your nose to obtain a tight seal. Lastly, perform a fit check to ensure there is a good seal against the skin. Forcefully inhale and exhale several times. The respirator should collapse slowly when you inhale and expand when you exhale. You should not feel any leakage between your face and the respirator and adjust if necessary. It is important that you know how to properly perform a seal check to ensure the respirator fits correctly. There is a positive seal check and a negative seal check. For a positive seal check, exhale sharply. A positive pressure inside the respirator means there is no leakage. If there is leakage, adjust either or both the position and tension of the straps, then retest. Repeat until the respirator is secured properly. For a negative seal check, inhale deeply. If there is no leakage, a negative pressure will make the respirator cling to your face. If there is leakage, this will result in air entering through gaps in seal. To properly don goggles, follow these steps. Always perform hand hygiene. Ensure that your mask or respirator is already in place before putting on goggles. Place the goggles over your eyes and place the headband at the back of your head, then adjust to fit. To properly don face shield, follow these steps. Perform hand hygiene. Ensure that your mask or respirator is already in place before putting on the face shield. Bending forward, hold on to the face shield with both hands. Expand the strap with your thumbs and place the strap behind your head so that the foam rests on your forehead. Then, check to make sure it completely covers the front and sides of the face. The face shield should go down all the way below your mask. To properly don gloves, follow these steps. But first, it is important to know that gloves come in different sizes, so make sure you choose the right size for a good fit. If the gloves are too big, it will be hard to hold objects and easier for germs to get inside your gloves. On the other hand, if it is too small, it is more likely to tear. Now, before donning hand gloves, ensure that all jewelry are removed and you have performed hand hygiene. Put on the first glove and roll the cuffs of the glove down your wrists. Then, Put on the second glove using the same technique. A description of how to properly doff PPE will be provided next. Please note that all PPE except the respirator must be removed before exiting the patient's room. Ensure to always perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. It is important to follow these steps when doffing PPE, as it is very critical to prevent contamination. The first step is to doff the hand gloves. The second step is to doff the goggles or face shield. The third step is to doff the mask or respirator. The fourth step is to doff gown. And the last step is to perform hand hygiene. If your hands get contaminated in between any of these steps, immediately perform hand hygiene. A detailed process for doffing each of these items will be presented next. To doff gloves. First, note that the outside of the gloves are contaminated. Please try not to touch it when doffing gloves. Using a gloved hand, grasp the palm area of the other gloved hand and peel off the hand glove. Then, holding the removed glove in gloved hands, slide fingers of the ungloved hand under the cuff of the gloved hand without touching the glove's exterior. Proceed to peel off the second glove over the first glove. Discard the gloves in a waste container and wash your hands. You must never reuse disposable hand gloves. Also, if your hands get contaminated when removing the gloves, immediately wash your hands or use an alcohol-based hand sanitizer. To doff goggles. First, note that the outside of the goggles are contaminated. Please do not touch it when doffing goggles. Remove the goggles by lifting the headband over your head or lifting the sides of the headband. Again, if your hands get contaminated during goggles removal, wash your hands immediately or use an alcohol-based hand sanitizer. If the goggles are reusable, place them in a designated receptacle for reprocessing. Otherwise, discard in a waste container. To doff face shield. First, note that the outside of the face shield is contaminated. Please do not touch it when doffing face shield. Tilt your head forward slightly. Grab the strap and pull it forward and over your head, which will let the face shield fall from your face. Then, discard in a waste container. Again, if your hands get contaminated during face shield removal, wash your hands immediately or use an alcohol-based hand sanitizer. To doff gown. First, note that the gown front and sleeves are contaminated. Please do not touch it when doffing the gown. You will begin by unfastening gown ties, taking care that the sleeves do not touch your body when reaching for ties. Pull the gown away from the neck and shoulders, touching the inside of the gown only. Then, turn the gown inside out and fold or roll into a bundle, and discard in a waste container. Again, if your hands get contaminated during gown removal, wash your hands immediately with soap and water or use an alcohol-based hand sanitizer. As stated earlier, there are different types of masks and they come with different ways of doffing them. Note that the front of the mask is contaminated, so avoid touching the front of the mask. Only touch the ear loops, ties, or bands. To doff a face mask with ear loops, hold both of the ear loops and gently lift and remove the mask. To doff a face mask with ties, untie the bottom bow first, then untie the top bow and pull the mask away from you as the ties are loosened. and to doff a face mask with bands. Lift the bottom strap over your head first, then pull the top strap over your head. Again, if your hands get contaminated during mask removal, wash your hands immediately with soap and water or use an alcohol-based hand sanitizer. To doff respirator. First, note that the outside of the respirator is contaminated. Please do not touch it. But if your hands get contaminated during respirator removal, wash your hands immediately with soap and water or use an alcohol-based hand sanitizer. Begin the doffing process by tilting your head forward. Use both hands to grab the bottom strap. Pull to the sides, then over your head. Next, use both hands to grab the upper strap. Pull to the sides, then over your head. Keep tension on the upper strap as you remove it, which will let the respirator fall forward. Discard in a waste container. An instructional video on how to properly don and doff PPE is included as extra resources in the materials section. Please watch for more information.